Are you over 40? Or do you have a family history of colon cancer? Then let me ask you, have you booked your first colon screening yet? I know. Just the word colonoscopy makes people uncomfortable. But what if I told you that we have a very good non-invasive test that is being used in many European countries before considering a colonoscopy? And when needed, this 30-minute procedure could literally save your life. Today, I'm breaking down when to get screened, who actually needs it, what to expect, and why delaying it could be the biggest health mistake you make. Colon cancer is the third most common cancer worldwide. But here's the good news. When caught early, it's also one of the most treatable and with higher survival rate. Most colon cancers start as a small, non-malignant growths called polyps. Over time, usually 5 to 10 years, some of these polyps can turn into cancer. Occult blood and stool test is simple, non-invasive, and has a high negative predictive value. What is this meaning? That if it's negative, the chance of having a cancer are really low. When it's positive, we will proceed with a colonoscopy, which is the only test that can detect and remove these polyps before they become a problem. That means it's not just a test, it's prevention. So who exactly needs this? Protocols and studies recommend to start making this stool test yearly after 45, but I usually suggest to start earlier, around 40, regardless of symptoms. If you have a parent, sibling, or child diagnosed with colorectal cancer, start 10 years before their age of diagnosis. If you have inflammatory bowel disease, like ulcerative colitis or Crohn's disease, you are also at higher risks. If you've had rectal bleeding, unexplained weight loss, or persistent abdominal pain, don't wait. Get checked. This isn't about fear, it's about being one step ahead. If your first colonoscopy is normal and you are a low-risk patient, you may not need another for 10 years. If polyps are found, your doctor may recommend to repeat it in 3 to 5 years depending on the type and number. Let's talk about the colonoscopy preparation, because this is where most people get nervous. Colonoscopy prep involves two things: dietary changes, usually a low-fiber diet 2 to 3 days before, and then clear liquids the day before, and a bowel prep solution, which is a laxative drink that clears your colon. Here's a tip: chill the solution, drink it slowly through a straw, and stay close to the restroom. Remember, take clear liquids, hydration, early prep, and rest. The cleaner your colon, the more accurate the test. And yes, you can eat normally the next day. On the day of the procedure, you will be sedated, so you won't feel or remember much. A thin flexible tube with a camera is inserted through the rectum to examine the full colon lining. If polyps are found, they can be removed in the spot. The whole thing usually takes 20 to 30 minutes. And no, you don't need to take the whole week off. Most people return to normal life by the next day. Now, let's clear up some myths. I don't have symptoms, so I don't need it. Colon cancer is often silent in early stages, and that's when exactly we want to find it. Another: it's painful and embarrassing. You will be sedated and cared for by professionals. It's quick, safe, and respectful. I'm too young. Not anymore. You have to know that the diagnosis age for colon cancer is progressively reducing. The causes remain unknown. Colonoscopies aren't about fear. They are about freedom. Freedom from worry. Freedom from silent disease. Freedom from what ifs. If you are 40 or have risk factors, don't put this off. Book your screening. Talk to your doctor. And remember, prevention is always better than cure. Book your consultation. Click the link below or call us to know your options.